Good morning, everyone. This is Katie Novotny calling in from Premier Marketing. I want to thank you for joining us today. I know this is a really busy time for a lot of you as it's AEP, and we just wanted to take a quick moment to remind you of some alternative or ancillary products that we have here at Premier. We have seen a big increase in people's inquiries of home care and really kind of the catastrophic type coverages. That being said, we are one of our first go-to is the recovery care product of Aetna. So today I have Jamie and Tony of Aetna here to kind of walk us through some sales ideas and where we're really seeing things that are effective in the market. So as a reminder, as questions come up, please feel free to type them and we will handle everything on the back end. And with that, Tony, you ready to take it away?
Yeah, thank you very much, Katie, and thanks to everybody. I mean, for the group that's on the phones today, thanks a lot. I know it is like Katie said, it's crazy time, and everybody's going full throttle. So thanks for just taking a deep breath here, trying to learn a little bit more about the recovery care. And I think right now, as people are out there doing a lot of Medicare supplements, traditional Med Sup, doing Medicare Advantage, you're checking in with your clients. Always remember to, obviously you folks that are on here, I'm sure are in tune with this, but we always want to make sure we're talking about other products that can fill the holes and the voids that, everybody thinks having a Medicare supplement's great, and it is. But the one thing we always have to remember is it doesn't cover everything, right? So there's things out there, there's holes, there's gaps, whether it's hospital indemnity plans, cancer insurance, and the great recovery care plan and home care plan that we offer. So without further ado, I won't step on any more toes. I'll just turn it over to Jamie Sarno, who will walk you through and share his thoughts on how you can increase your recovery care sales. Jamie, go ahead, please.
Yep. Thank you, Tony. Thank you, Katie. Great to be here. And today we're going to talk about short-term care with Aetna, recovery care, home care plus, and a brand new product for Texas only, and you'll find out why here in a minute. But everything that's going on right now, all the hard work for AEP, and even throughout the rest of the year, when we place or sell a product to an individual, you really want to anchor that product in there. And they're called core products, Medicare Supplement, Medicare Advantage. We all know that it is much better. You have a much better retention when you can place two products in a house. Two's better than one, right? Even three products and four products. So this will just give you a little bit more that you will have in your toolbox that you can offer someone that already has your Medicare Advantage plan or your Medicare supplement. So first of all, talking about Medicare, currently Medicare has about 61 million beneficiaries. That's a lot of people that the government is paying for. That's 18% of the US population that are enrolled in the Medicare program. Now, here's what's scary. Enrollment is expected to rise to 79 million by 2030. And you may as well say 2021 is just about over. So we have 8 years left of getting to this 79 million. And what you're going to find is a lot of Medicare programs and benefits are going to start changing, and not changing for the better, changing for the worse. Like this one. Under a new cost-cutting measure, Medicare is changing the way that they pay on surgeries, or should I say the way that they would confine a person for a surgery. And basically it works like this. And I bring this up because you're going to see where hospital stays are going to be shorter. For years, the Centers for Medicare and Medicaid Services classified 1,740 surgeries and other services so risky for older adults that Medicare would pay for them only when they were admitted to a hospital as an inpatient. So what they're doing now is they're taking, under a new rule, 1,266 shoulder, spine, and other musculoskeletal surgeries and crossing them off the inpatient only list. That is big news. So things like brain surgery, heart operations, all of those things by 2023, the hospital will have the option of, you know what, that needs to be outpatient, or it could be observation. And we all know when a Medicare patient is placed in observation for a hospital, it's very hard for them to get the 3 days of inpatient care that they need in order to get 20 days of skilled nursing paid by Medicare. It doesn't happen. Does not count towards their 3-day requirement to be an inpatient to get the 20 days. So what happens? That entire bill ends up being the consumers, the patients. Now, many of you may know this website, and yes, I'm promoting it, but this right here is Genworth's cost of care calculator. And let's see if I hit the button here, I think it'll move. But this is a great tool to use for any of your clients. If you've got an iPad, you've got a laptop, take it into your meetings. If you're using Zoom, pull up the website. You can go to any state. I picked, you saw I had Nebraska there. I flipped over to Kentucky. I'm in Louisville. And you see at the bottom, every time you change on the map, it will show you what the average cost is. So back in the Omaha area, you can see at the bottom there, you can pick hourly, daily, monthly, annual. But this will help your to-be customer see what they are up against. If they have one accident, one sickness that causes them to need some type of care, whether it be at home, nursing home, or assisted living, they will really understand. They see something that cost over $100,000 for 12 months. That's devastating to a lot of families. So this is a great tool to use. I use it all the time. I promote this website all the time. Then we can get into Aetna Recovery Care. So recovery care is exactly what it sounds like. It does not matter if someone is out of commission for a week, a month, or a year. This plan is available to take care of them from day one if that's the way the plan is set up. There is what we call a quick view underwriting drug list. Some companies don't require a drug list or offer a drug list for you to run down to make sure that you have a good sale. Aetna wants you to know if there's a drug that a particular person is taking that is uninsurable, meaning that they would not be able to pass underwriting for recovery care. Aetna wants you to know that at the point of sale. They do not want you to submit an application, have it rejected, because what that does sometimes is that just puts a bad taste in your applicant's mouth because they've been rejected, their feelings are hurt, and they might just say, never mind, I don't want that anyway. You'd never want that to happen. So Aetna has a drug list. That is for you to make sure that you have the sale clinched. And it's very easy to use. AetnaSeniorProducts.com, click on the drug list, and each plan has its own drug list. Recovery care, home care plus, you'll see it all there. What's also wonderful, no underwriting phone interview. You are not going to have to call into Aetna after you have sold your individual and now you're filling out the application. You can lose a lot of steam when you have to call into a carrier and then they have to ask them questions that you've already asked them. That's not going to happen with Aetna Senior Supplemental. No phone interview. You do not have to call into the home office. Also, no medical records are required to issue the plan. They're not going to do that. They're going to run a prescription drug check in the background automatically when you submit the application, and it will pull up what they're taking and why they're taking it. So it's very easy. No hospital stay required, and e-app available with personal security question signature. Here is another big deal when you're selling an Aetna product. All you need to do to have the applicant sign the application is, Mrs. Jones, your signature is going to be electronic, meaning you will give me a security question answer and I will type it in and that will sign everything for you. You never have to put pen to paper. You do not have to answer automated voice signatures, nothing like that. There's no emails to fool with. All you have to do is, for instance, Mrs. Jones, what's your mother's maiden name? She gives me the maiden name. I will put that into the computer myself, the agent. It will sign everything for Mrs. Jones. She will never have to sign anything or receive anything over the internet. Renewal premiums do not increase because of age or health changes. So what does this mean? Does that mean that the plan can never increase? No, it can increase like any other product can. But I will tell you this, Continental Life Aetna has offered short-term care plans for nursing home and home health care since 1996. They have never had to have a rate increase in any state. So these plans are very well managed. You will not find where they increase because of a birthday, where maybe there's an age band of 65 to 69 is one age, 70 creates a new premium. No, that's not what happens with the Aetna products. We have people that took these plans out 25 years ago that are still paying the same premium today. So it's very unlikely that these plans would have to have any kind of rate change. And you also get Aetna, the trusted household name. There are lots of carriers out there, and there's other good carriers out there. We all know that, but the Aetna name resonates with people. And if I can place a product that has amazing benefits, amazing premiums, and it has the Aetna name on it, that is a combination for someone to keep that plan year after year after year after year, which is, guess what? Great for them because they have coverage, and great for you, the agent, because you're building a renewal and it's going to grow and grow and grow. So what are the benefits? Ages 50 to 89, there are no gender-based rates. So male, female, same exact premium. No height and weight chart. This is big. On all of Aetna's indemnity plans, they do not ask height and weight. Doesn't matter if it's hospital indemnity, whatever it is. Hospital coverage, it also does come with at $10 is required for hospitalization with the way that we filed the plan, but you can also offer up to $300 a day in any hospital. It will also pay for observation stays. So a $10 benefit is required when you are submitting an e-app or filling out an e-application. It's automatically going to add the $10 in there. If you're using a paper app, just remember to add the $10 to it. And it pays in addition to any other insurance. So if they have they have a Medicare supplement, Medicare Advantage, another hospital indemnity, another long-term care plan or short-term care plan, this plan's going to pay the full benefit. Doesn't matter if the bill's paid in full already. Aetna is going to pay it directly to the insured unless they assign the benefits to the provider. It will pay in any nursing home and any assisted living facility. Does not have to be approved by Medicare. If they're a licensed facility for nursing care, meaning any nursing home, any assisted living, it will pay there. And you can choose a daily benefit for nursing care, anywhere from $10 per day to $300 per day. There are only 3 levels of care in a nursing home. This plan will pick all of them up: skilled care, intermediate, and custodial care. Also, you can choose how long you want this benefit to be. You can choose just a 90-day plan, 180-day, 270, or a 360-day plan. It's 5 days short of 365 days, and I know you all probably already know this, but if it was 5 days more, it would be considered long-term care. Being 5 days under, it's short-term care. That's the only difference. Facility care equal to twice the benefit. So basically what this is, it's a restoration of benefit. And the way it works is like this. If you choose a 90-day plan, you're going to get 90 days twice in a lifetime that are available to you. If you pick a 360-day plan, you're going to get 360 days twice in a lifetime. So this is a very good feature. It's available in probably 99% of the states that it's offered. The plan recovery care is offered in. Texas, it is not, but it's a very good reason for someone to see, hey, you mean that I could use this not only 1 year, but maybe potentially 2? Yes. And you can choose a waiting period. Now, myself, I typically will offer a 0 waiting period, even if they have a plan that starts immediately. As I said earlier, Medicare sometimes will pay the first 20 days, but if you're in observation, you're not going to get that paid by Medicare. So if I give them a first day coverage benefit, it doesn't matter if Medicare pays or not. This plan's still going to pay from day one. And remember, any licensed assisted living facility, Medicare will not pay on an assisted living facility. They never have, probably never will. It's too expensive. But they have some beautiful assisted living facilities now. And you may have a client that says, I'm never going to a nursing facility, a nursing home. And you can't blame them. But when you talk about these beautiful assisted living facilities, they look like 5-star hotels, you can go to those and Aetna will pay it. Then there is the only rider available on recovery care is the home care rider. It's optional, but when you find out what it does, you'll want to add it every time. It will pay any licensed home health care agency, medical and non-medical. So what does that mean? Medical is what Medicare will send out for an hour every other day, about 3 times a week, and that only lasts for 3 weeks under Medicare, and they don't do much. That's what you call like physical therapy, speech therapy, respiratory therapy. This plan, recovery care through Aetna, will pay that type of care, but it will also pay the non-medical, like someone sitting with mom, preparing a meal, shopping for groceries, light laundry, taking the patient to the doctor's office. All of these things, companionship, that's something that Medicare doesn't pay. This plan will also pay for that type of home health care. And this is a weekly benefit, not a daily benefit. So it goes from $150 units per week up to $1,200 total maximum per week. And you can choose 13 weeks, 26 weeks, or 52 weeks. Now, here's what's amazing. That 52 weeks is in addition to the 360 days that you see above for nursing home and assisted living. So that's right. If you have the home care rider for 52 weeks and you give the full maximum benefit above for nursing home assisted living of 360 days, you're going to have a 2-year plan here. Potentially 4 years, because both of them restore back to twice their amount. The only thing that has to happen, you have to go 6 months without needing care, then you requalify and it will pay again. So there are the benefits. They're strong. It really is. I'm an old long-term care agent. I sold long-term care for 24 years. And what I found, long-term care is amazing and great and very necessary. These plans are not to replace any long-term care plans that are out there. I want to make sure that's clear. But you're going to run into certain individuals that they may not be able to qualify for long-term care because of health conditions. This is a great plan to introduce to them. Maybe they can afford a long-term care plan, but they don't want to afford the long-term care plan. They can get pretty pricey now. This is a great plan to offer your clients. So please look at it, and I'm going to show you here. Oh, I forgot about this. So what you can do, let's say you run across an individual, they say, I'm not going to the nursing home, and I'm not going to go to that assisted living that you said is like 5 stars, like a 5-star hotel. All you have to do is give them $10 of nursing home care, $10 of hospitalization, and you can maximize the home care rider. You can go 52 weeks at $1,200 if you want. You can go 13 weeks. You can do whatever you want there, but you can maximize that home care rider. Now, that recovery care plan, it's almost like a standalone home care. And people love to be at home. So that's a great, great thing. Now, I will say this. In Texas, and I'm bringing up Texas for a reason because I want to show you this new product, but in Texas, Texas would not allow 2 things. It would not allow the home care rider to be placed on recovery care because they said that was over a year of coverage. And they would not allow Texas to have the restoration of benefit where you can use it twice in a lifetime. So that was, kind of fighting with one arm tied behind your back. And I'm going to show you the difference here. But I want to tell you the triggers for recovery care. This goes for recovery care, the assisted living, all of those things. As long as the patient's doctor, not an Aetna doctor, there is no Aetna doctor, as long as the patient cannot perform 2 of the 6 ADLs or they're cognitively impaired, that will cause the policy to start paying. So just 2 of the 6 ADLs or cognitive impairment, and you can use the plan. With home care, those 2 things apply, but all they need to be getting is 3 weekly 1-hour visits on separate days. So what that means is an hour on Monday, Tuesday, Wednesday, an hour on Monday, Wednesday, Friday. It doesn't matter as long as it's 1 hour 3 times a week on separate days. And guess what's going to happen? They're going to pay the full indemnity amount. For just 3 1-hour visits per week, they will get the full $1,200 to spend any way they like. That means if they decide, you know what, I want to pay my neighbor for making us meals. Now, the policy trigger is not going to pay the neighbor, but the money you receive, you can do whatever you want with that money. So that's very good to know. Also, just so you can see what the rates are at a glance, $100 a day, I maximize it out to 360 days. For a 65-year-old, now there's no home care added here, it's nursing home and assisted living I use, it's only $42.94 a month for a $36,000 benefit. $200 a day for 360 days, $72,000 benefit, $84.11, and maximizing the benefit, $300 per day for 360 days, $108,000 is only $125.27 a month. And remember, these premiums are not going to increase because of an age change or health change. They're on a fixed income. They should have something that stays fixed or has the likelihood of staying fixed. Now, the application, very quickly, I just want you to see, it has less underwriting than our Aetna Medicare supplement. For any of you that know our underwriting, you will know less underwriting on a Medicare supplement, that's pretty darn good. And I'm going to just open these boxes up here so you can see it all at one time. And you'll see, basically it asks, are you currently hospitalized, bedridden, receiving home care? In the past 36 months, have you had congestive heart failure, internal cancer, Alzheimer's, AIDS? In the past 24 months, oxygen use, stroke. Have you been hospitalized 3 or more times? I always thought that was amazing. You mean they can be hospitalized twice in the past 2 years and still get this plan? Yes. And diabetes. So if you're type 2 diabetes, no insulin, that's easy. They can get approved. If they are taking 50 units of insulin daily or more, 50 or more, they do not qualify for this plan. But there's an alternative. Anything that's 49 units a day or less, yes, this plan will take them. And then in the past 12 months, have you had any seizures, pending treatment or test or surgery? It's very easy to qualify for this plan. And there you go. That's what our national footprint looks like. We are constantly trying to get into more states. We will keep pushing. And Katie and Tony will let everyone know when we get into new space out there. Now, I want to show you, and this is the Texas only plan. So here's what Aetna did. They said, we don't want Texas agents to be, like I said, fighting with one hand behind their back, one arm behind their back. So they developed, just for Texas, a home recovery care plan. This is strictly just home health care, and it's strictly for Texas. But they achieved a couple of great things here. It will pay medical and non-medical home health care. And what's different about it than the home care rider that's available everywhere else that Texas doesn't have, it has a maximum of $3,000 per week benefit. So yes, everywhere else, don't be jealous, but everywhere else it's $1,200 a week maximum. On this plan for Texas, it's $3,000 a week, $156,000 for 52 weeks of care. You cannot beat it to have any home health care agency in there. So you can choose 13 weeks, 26 weeks, 39 weeks, and 52 weeks. Also, they got it done. Lifetime maximum equal to twice the number of covered weeks. There's a restoration of benefit in this now. You can use it twice in a lifetime. So potentially up to 2 years out of this plan. And same triggers, 2 ADLs or cognitive impairment. Also, there is no deductible, no elimination period. It starts day 1 or week 1. Also, no hospital stay required. And no hospital benefit is included in this plan. So you do not have to have a minimum of $10 on the Texas Home Recovery Care Plan. It makes it less complicated when you're trying to figure out a premium, and it's just a better plan. If they are going to need hospitalization, go ahead and put them on the Aetna Hospital Indemnity Flex Plan. It's a great plan, and it will pair very well with a like Aetna product like home recovery care. So this brochure is amazing too, because it talks about personal homemaker care, help with eating, bathing, toileting, dressing, personal hygiene, help moving in and out of a bed or chair, laundry and light housekeeping, meal preparation. All those things are non-skilled. Medicare will not help you with those. Now, medical care would be nursing care, physical therapy, occupational therapy, speech therapy, nutritionist services. Those are skilled services. And like I said, Medicare does pay for those, but it's 1 hour every other day. Typically, the maximum Medicare is coming out is 3 times a week, And Medicare is very limited. It will typically last at the longest 3 weeks. That's it. And companion care, help with taking medications, transportation to and from appointments, shopping for food, medication, and medical supplies. Again, that's non-skilled care. Medicare does not help with those things. So it's an amazing plan. If you are able to sell in Texas and you're appointed, by all means, offer this. It's very good. And now this just fills the gap that was left there, not being able to have that home care rider on the Texas recovery care. So just remember it's there. Now, I want to show you one more thing, and then we'll call it a day here. But we also have what's called Home Care Plus, Continental Life Aetna. So why do you have another standalone home care plan? Well, number one, this is available in Texas, Nebraska, Kentucky, Tennessee. It's available pretty much everywhere. You'll see the map here of where our footprint lies. But why do we have this? Because it does a lot of the same things, right? There's no height and weight chart. There's the underwriting drug list, no phone interview, no medical records, no hospital stay. Premiums do not increase because of age or health. And plus, we have that great e-app with personal security question signature. So why does this plan exist? Here's why. When you have a client, an applicant, that is not going to pass the underwriting, maybe they didn't pass for long-term care, so you pull out recovery care. You look at the drug list and you see, oh, they're taking a drug for Alzheimer's or for Parkinson's, and they don't qualify for recovery care or home recovery care in Texas. This plan has very light underwriting. This is your go-to. So why? Home Care Plus pays for medically necessary home health care only. That means as long as they're getting 3 visits per week on separate days again for physical therapy, speech therapy, respiratory therapy, any of those type of things, that $1,200 benefit is going to come out. And look what's acceptable. These are acceptable underwriting health conditions, meaning if they have Alzheimer's or take memory medication, they will qualify for Home Care Plus. Seizure disorder, cane or walker use, Parkinson's disease, heart attack or stroke over 12 months, they can get the plan. Cancer-free over 12 months. Current oxygen use, they can get this plan. Connective tissue disorder, rheumatoid arthritis, diabetes with no insulin limit. That means they may take 50 units or over, doesn't matter. This plan they can get. Dementia and macular degeneration. All of these things are acceptable under Home Care Plus. Now, do not get it confused with any of the recovery care line. Recovery care, home recovery care, these things would be unacceptable. That's exactly why Aetna has this plan available. When they can't get the other plans, this is the next best thing. So you will see ages 50 to 89. What is medically necessary? I told you, therapy visits, physical speech, occupational therapy, intravenous therapy and antibiotics. Wound care is classified as skilled. Up to $1,200 weekly maximum. Same as the rider, 13, 26, 39, and 52-week benefits. And like I said, 3 one-hour medically necessary practitioner visits per week on separate days activates the plan. There's the definition there. And it also comes with a hospital indemnity, $10 to $300. This still does require at least $10 per day of hospitalization, but the e-app will automatically include it. And you also get a maximum lifetime benefit. Now that's for the hospital of 360 days. You do get twice the lifetime benefit under that plan too. And just so you can see what the rates at a glance are for age 65, I'll open them all up here. And you can see very affordable, all the way up to 52 weeks, maxing it out at $62,400 per 52 weeks, $92.45 a month. So this is why there is a plan for everyone under the Aetna Senior Supplemental umbrella, from Medicare supplement to cancer plans, hospital indemnity, short-term care, dental, vision, hearing, final expense, you name it, they have it. And again, just to show you, less underwriting than recovery care, and I'll show you very quickly. Look at this, it's very short. In the past 12 months have you had, and then that's pretty much the end of that. But please look at our plans. They're very good, especially now during AEP, and Home Care Plus is in Texas. And don't forget about the Aetna mobile rate app, which is called Quotes on the Go. So you can just go to the App Store. Does not matter if you're an Android lover or an iPhone lover, download it and you can start quoting every product in the senior supplemental line of Aetna, which is very, very good. Just fill in the spaces here and you're off and running. And we don't have to show you that. You all know how to use the phone. And Katie, I don't know if anyone has any questions. They're more than welcome to.
We do actually. First off, thank you both. I really appreciate the overview on this. One question is, if a client uses, this was typed in when you were going over recovery care, just to preface, but it says here,
Sure.
If a client uses the twice in a lifetime benefit, then what? Do they have to re-enroll, or are they now unqualified for coverage under this plan?
Well, it's a great question because it brings it on to a whole new level there. So if by chance they use both of their maximum, so they use 360 days total, and they could use a month here, 3 months there, 4 months there, but let's say they use up their entire 360. As long as 6 months goes by without needing care and they use another 360, if that were to happen, the policy would be pretty much exhausted. So they wouldn't want to pay on that policy if it's paid out a total of 720 days. Now, as far as would they qualify again, if they were out of the nursing facility for over, let's see, they would go back through the medical questions again, and it would ask their underwriting questions. As long as they could qualify again by underwriting, sure, they could take the policy out again. Now, again, that may seem a little ambitious, but yes, that is possible. And yes, they could do that. So thank you for the question.
Perfect. Another question is, if a client would buy coverage and move after they retired, is this coverage portable?
Yes, it is. Even in a state where short-term care is not available, let's say Florida, for instance, or California, New York, as long as you took it out in your home state where it was approved, if you move anywhere, it will follow you. In the continental United States, that is.
Perfect. Another question is regarding stacking the policies. Could you purchase more than one? And are these policies or various Aetna products stackable?
Yeah, they are stackable, but with limits. So let's say, you sell someone a recovery care plan for $200 a day for 360 days. And then they call you the next year and say, hey, I would really like more benefit, or I would like to go up to $300 a day. You can sell them another recovery care plan for 360 days, but you'd only be able to go up to $100. So it can only be a total of $300 a day. So that's the maximum on nursing home and assisted living. So they could have 3 policies, all for 360 days for $100, $100 a day, $100 a day, as long as it's totaling $300 total with the company. Same thing for home care. The home care rider or the policy for home care plus, which is the light underwriting, the company maximum is $1,200 per week. So you could give them 2 policies, but they cannot be over $1,200 per week total combined policies. Now, just to confuse you even more, if you're in Texas, the home care maximum would be $3,000 a week. So for instance, if someone had a $1,200 a week home care plus already in Texas, and this new plan just came out, and someone wants to add to that, they can, but they cannot go over $3,000 per week in Texas only. So I hope I answered that without making your head spin.
Another one, it says, is this plan available for people that are living in 2 different states? Some that will do 6 months here, 6 months there. Second question to that is going to be, is network not an issue? So if you could address kind of our snowbirds and then also regarding networks.
Well, there are no networks. You go anywhere you want anytime. This is not like a Medicare Advantage plan where you have certain nursing homes or certain home care agencies. That's what the beauty of it is. It's freedom to choose. Now, as far as being dual residents in a state, if you're paying taxes, and this is the way I've been told from the higher ups, if you're paying taxes in the state, property taxes, then you can use whichever state you're paying property taxes in, because you have a dual residence there.
Perfect. Another request was if we could pull back up that slide that showed the name of the quoting software.
Yes, be glad to do that. There you go. I will clean that up a little bit here. So yes, this app is so great. And one of the great things about it is, now everyone make sure you're appointed with Aetna Senior Supplemental, and I'm sure everyone is that's on the call. You do not have to log in. You don't need your agent number to log into this. So really, in reality, anyone can download this app and use it. You don't even have to be associated with Aetna to use it, which I like because you can automatically go and start quoting. So do not put in Aetna quotes on the go. Just put in the search bar quotes on the go, and then you'll see the icon, the purple icon there, top left, and it will have Aetna on it. But it's a wonderful, wonderful thing. Very simple to use. You put in the zip code, it's going to let you know what products are approved there. It will not show you a product that's not available in the state.
Perfect. Well, I think we have handled them all. As always, if there are additional questions, please feel free to give us a holler here at Premier. If we get a little stumped by your question, I'm sure Jamie or Tony would be more than happy to help us out on this as well. So if there's anything else, like I said, please feel free to give us a call and we will walk through it. And I want to thank everyone, especially Jamie and Tony, for today. I think this was a great overview, and I appreciate everybody's time, and best of luck during AEP. So with that being said, everyone have a great day. Thanks, guys.
Thank you.
Thanks, everyone.